Welcome to Bipolar Talks, your go-to space for real, thoughtful, and mindfully crafted conversations about mental health, with a special focus on bipolar disorder. If you're here, you're probably someone who's curious, maybe even personally impacted by these diagnoses, and looking for clarity. So take a deep breath, settle in, and listen mindfully as we explore today's topic: bipolar versus borderline. What's the difference? Before we dive in, don't forget to like, comment, subscribe, and share this video with someone who might benefit from it. Every click helps us reach more people who need thoughtful conversations around mental health. Let's start with a big picture question. Why do we even need to talk about bipolar disorder and borderline personality disorder side by side? These two conditions are often confused in everyday language. Maybe you've heard someone casually say, "She's so bipolar," or "He must have borderline." These labels get thrown around, especially online, often without a real understanding of what they mean. But for people living with these diagnoses, or trying to find the right one, this confusion can delay treatment, strain relationships, and cause unnecessary shame. So today we're slowing down, being mindful, and giving each of these conditions the nuance they deserve. We'll cover the core features, the emotional patterns, the timelines, and the treatments, plus why misdiagnosis happens, and what to do if you're unsure where you fit. Sound good? Let's begin by understanding each condition on its own. Bipolar disorder is a mood disorder, meaning it primarily affects a person's emotional states, how high, low, or stable they feel over time. It's categorized into types, most commonly bipolar I and bipolar II, based on the intensity and duration of manic or depressive episodes. Bipolar I is defined by at least one full manic episode, often followed by depression. Mania can include grandiose thinking, little or no sleep, excessive energy or activity, risk-taking behaviors, pressured or rapid speech, distractibility or racing thoughts. These episodes usually last a week or more, and often require hospitalization or cause major life disruption. Bipolar II, on the other hand, includes hypomania, a less intense form of mania that might still include increased energy, creativity, and sociability, but usually doesn't lead to major dysfunction. However, the depressive episodes in bipolar II can be severe and prolonged. So, bipolar is all about mood shifts from high to low with clear episodes that come and go over time. Borderline personality disorder, or BPD, is classified as a personality disorder, which means it affects patterns of thinking, feeling, and relating to others that are stable over time but deeply painful and dysfunctional. The key traits of BPD include intense fear of abandonment, unstable relationships, idealization followed by devaluation, rapid mood shifts, often in response to interpersonal triggers, chronic feelings of emptiness, impulsive behaviors like spending, sex, self-harm, or substance use, unstable sense of self, emotional dysregulation, feelings that escalate fast and feel impossible to manage. These patterns usually begin in adolescence or early adulthood and are persistent over time, not episodic. So unlike bipolar disorder, which has distinct mood episodes, BPD is more like a continuous emotional storm. Here's a helpful way to hold these differences in your mind. Bipolar disorder is about mood states over time. Borderline is about emotional reactivity and identity disturbance. If someone with bipolar disorder is between episodes, they might feel relatively stable. But someone with BPD often struggles with emotional instability every day, especially in their relationships and sense of self. Ask yourself, are the changes episodic, bipolar, or triggered and rapid, borderline? Do the emotional shifts last days to weeks, bipolar, or minutes to hours, borderline? Is the issue internal mood fluctuation, bipolar, or does it revolve around how I relate to people and myself, BPD? Now let's talk about something that trips up even professionals: overlap. Bipolar disorder and BPD can share features. Both may involve mood swings. Both can include impulsivity. Both can be linked with substance abuse, self-harm, and suicidal thoughts. Both may disrupt relationships. Because of this, it's not uncommon for someone to be diagnosed with one, then later reevaluated for the other. Sometimes a person may even have both. Yes, comorbidity is possible. Here's where a mindful, thorough psychiatric evaluation becomes critical. Rush diagnoses based on a single session or one bad week can miss the complexity of what's really going on. Let's go technical for a moment. How do professionals tell these two apart? For bipolar disorder, diagnosis typically relies on the presence of manic, hypomanic, or depressive episodes, patterns that fit DSM-5 criteria, timeline and impact over time, reports from family or close friends, sleep, energy, and behavior patterns. For BPD, diagnosis focuses on 9 DSM-5 criteria, 5 of which must be met, including frantic efforts to avoid abandonment, unstable self-image, impulsivity, intense anger or difficulty controlling it, a history of unstable interpersonal relationships, emotional intensity in response to real or perceived rejection. Psychiatrists often use clinical interviews, mood charts, personality inventories, and collateral information to make these distinctions more accurately. Treatment matters because the right diagnosis means the right care. For bipolar disorder, the foundation of treatment is medication. Mood stabilizers like lithium, atypical antipsychotics, antidepressants, cautiously, and usually alongside a stabilizer. Psychoeducation and therapy, particularly CBT or interpersonal therapy. Without medication, the risk of relapse in bipolar disorder is high. Therapy supports coping and stability, but medication is usually essential. For BPD, the gold standard is psychotherapy, especially dialectical behavior therapy (DBT). Focuses on mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. Mentalization-based therapy (MBT). Schema therapy. While meds can help with mood symptoms or co-occurring issues like anxiety or depression, they're not the core treatment for BPD. The healing work happens in relationship-focused, skills-based therapy. Let's bring this down to the human level. Living with bipolar disorder often means managing episodes that feel out of your control, protecting your sleep and schedule, and recognizing early signs before things escalate. Living with BPD often means working daily on emotional regulation, understanding attachment wounds, and learning to tolerate distress without acting on it. Both conditions are serious but treatable. People recover. People live full lives. People fall in love, hold jobs, raise children, make art, lead, and thrive. If you or someone you care about is questioning their diagnosis, here are a few mindful steps to consider. 1. Find a qualified psychiatrist or clinical psychologist, preferably one with experience in mood and personality disorders. 2. Track your symptoms over time. Journaling apps or mood charts can help. 3. Bring in trusted observers. Friends, family, or partners may offer insights you can't see yourself. 4. Be patient. Diagnosis is a process. A rushed label can do more harm than good. 5. Remember, it's okay not to fit perfectly into a category. Diagnosis is a guide, not an identity. Let's end with this. Language shapes lives. Calling someone so bipolar or such a borderline isn't just inaccurate, it's damaging. These are not personality flaws. They're serious mental health conditions that deserve empathy, accuracy, and respect. So let's talk with care, listen with intention, and support each other mindfully as we continue to learn. If this episode helped you understand the difference between bipolar and borderline better, please take a moment to like, comment, and subscribe to Bipolar Talks. Your engagement helps us bring more thoughtful content to more people. And don't forget to share this episode with someone who might need to hear it. This YouTube video is for informational purposes only. It does not substitute for a professional diagnosis, treatment, or advice. If you're struggling with your mental health or need support, please consult a licensed mental health expert.